You can't ignore the fact of prostate cancer, but you don't want it to consume your whole life. That's where this group comes in. It's not a club, it's just people seeking answers from people who've had experience. Just zoom in when you want to know how others have got on with something. Put cancer in its place. Go on to live the fullest life on your own terms.
Oh, I'll put my hand up again, Nev. I wasn't available for the last meeting because on that particular day I was getting booked into the Wesley for my procedure for an artificial urinary sphincter. According to the surgeon, everything went well. I was discharged a couple of days later, but it almost felt as if I was walking around with a bloody orange between my legs. I don't go back to, as I indicated earlier at the start, I call it commissioned. My wife says no, activated until the 5th of October. So they give you a 6-week period for everything to heal. I did have a few issues. There'd been spotting for the first couple of weeks, but on around about the 2nd week, my wife had toddled off to bed and I had to go and change my pad because I'm still going through about 8 pads a day. And there was blood everywhere. And I, of course, thinking all the worst things in the world. Now, if I had been 30 years younger and so had my wife, we wouldn't have worried about having a look at my perineum at 8:30 at night. But she had to. And she said, oh, looks like there's a stitch digging into the incision site. Oh, what, righto. So anyway, she dressed it. Fortunately, I had a pre-booked appointment with my GP 2 days later to have another deferralline injection. So whilst I was there, I got him to have a look and he said, oh, these should be dissolvable stitches and it's actually sticking back in and causing the area to bleed. So he said, I'll go and get a blade, which probably not the right terminology, but anyway, he removed, I thought he was going to remove everything for a while. He's removed it. It's been okay since. The swelling is slowly going down. So fingers crossed on the 5th of October, I'll get back to leading some sort of normalcy. I know I'm going to have some sort of pads or pull-ups or whatever for the first few weeks or months or what have you, but there's got to be something better than going through over an 8 or a 10 pack of pads every day. Probably the biggest issue that I've encountered, I refer to it as post-anesthesia brain fog, because this is my 4th procedure in less than 12 months. And enzalutamide's already got a brain fog with me. And it just seemed to be, it exacerbated the situation. So much so I even said to my wife, am I going into some form of early dementia because I couldn't remember who she'd been speaking on the phone to half an hour earlier. It was a chap I went to Japan with to watch rugby years ago. So I came back down from the shower and she was on the phone. I said, oh, who's on the phone? Oh, it's Greg. And half an hour later, I said, who are you talking to on the phone? And it's that sort of thing. And yeah. So I call it brain fog at this point in time, but has anyone else gone through any of, a decent dose of general anesthesia and are also on enzalutamide? No?
I've had various kidney stones and things where I've had anaesthesia while I've been on enzalutamide. I think the brain fog is something that happens with enzalutamide a bit anyway.
Yes.
My short-term memory is really bad news. It always has been. So maybe it was just a short-term memory thing with you, with your mate Greg sort of thing on the phone. I don't know. But yeah, no, nothing dramatic, but generally enzalutamide doesn't help.
Yeah. Well, I spoke with Larry Hamilton, and he's part of the Moreton Bay prostate cancer support group. And Larry indicated that he had spoken with specialists, and if you do forget things, but then later you can remember what you had forgotten, it's an aging process, or it's a brain fog. But if you can't remember what you didn't remember, that's when you start to need, some sort of intervention. So fingers crossed it's just post-anaesthesia plus enzalutamide together. Well, funny you should ask, Jim, because I've been on enzalutamide now for a year and a half. And when I saw my oncologist back in March, I said, look, I've just had enough of this for now. Can I go on a bit of a holiday with it? I'll still have the deferraline. And my PSA level marginally rose, but not anything to worry about. But my wife knew straight away when I'd gone back on enzalutamide, from not recalling things, and it dries my skin out something terrible. So there's got to be something with the enzalutamide, but that's as long back as I can go. It would have been about, to March, when there was a noticeable change from going off enzalutamide until I went back on them just recently.
Tony here. For some reason, I had a look at the enzalutamide packet a little while ago, and it did say something about Enza tends to stay in your system for quite a long time after you stop. So there's a lag time there about, where the Enza is still sort of around. It was particularly talking about, fathering children, which is not on my but they did say that it hangs around for quite a while after you stop.
Yeah. Oh well, fingers are crossed.
Righto, any other comments or questions to Peter? The incontinence issue, Peter, do you get subsidised from the government of the incontinence?
Yeah, I applied for the Commonwealth one.
Yeah, the Commonwealth one. Yeah.
Yeah, I am being subsidised, but from memory, it's $675 a year. But when you're using a pack a day, and they're $15 unless you go to Chemist Warehouse when they're on sale, and you can get them for $10. The 675 doesn't go all that far, but a female cousin of mine found out about my issues, and she calls a spade a bloody big shovel, and
nothing wrong with
that. She was able to source boxes of pads that were suitable for me through St. Vinny's, and I think from memory she was getting, and they're the they're the cardboard boxes, and there's 4 packs in each box.
Yep.
And the way it looks is that if somebody has passed away and the estate has handed those cartons over to whatever charity that they wished, and then the charity on sell them.
Right.
And you can pick up at various places. You can pick up a carton for $12 or $15, so basically a quarter of the price.
Yep. Yep.
So she's been doing that for me, which is fantastic. I only picked up another 2 cartons from her on Wednesday. So I do that one. I haven't bothered with there's a separate Queensland one. It starts with MAF or something like that. You might know it, Jim.
MASS.
MASS, yeah. Because a GP couldn't sign off on it. It had to be an incontinence nurse and or a urologist.
Mm. And
unfortunately, my urologist wasn't really interested in doing it. That's public hospital stuff, he sort of indicated. And I thought, oh, well, fair enough. So $6.75 is better than a poke in the eye with a burnt stick. And subsidised or supported by the other boxes that my cousin's been able to obtain. So I'm going okay at this stage.
Yeah.
MAAS, as far as I know, is almost unlimited. I'm sitting on a wheelchair here, dive left and right, you can see the head bit, that MASS has supplied $20,000 piece of equipment. And you're not in any aged care rating, are you?
No, I don't qualify for any sort of package or support at all, Jim.
Okay, so I guess it'd be worthwhile looking for a continence nurse who's going to visit you cheaply, because you'll probably, it depends how you go in the next few weeks, I guess.
Yeah, well, I'm hoping that come the 5th of October, and I know it's not going to happen overnight, but I'm hoping that progressively I'll be using less and less of the pads, and it won't be such a monetary burden.
Well, we hope so too, Peter, because it is a pain, and if you're going through so many a day, well, there's a lot of, you got to find somewhere to get rid of them all the time as well.
True, our rubbish bin is fairly full by the.
Yeah, but if you go out, not all the toilets are designed to cope.
Well, I don't go out, Nev.
Yeah, fair enough. Yeah,
I've become a bit of a recluse or a hermit, because I said to my wife, even if we just want to go out for a brunch or something, I've got to make sure that there's a toilet nearby, because it's rather difficult trying to pull your trousers or shorts down, your jocks, the pad, and then sitting on the toilet seat to empty your bladder or whatever's left, and then pulling back, putting new ones on, and
I hear what you're saying. Yeah.
Tony Sheehan's got his hand raised, Nev.
Oh, has he?
Yeah.
Yes, Tony.
To see that, Nev.
No.
I just wanted to ask Peter a question when he's finished.
Yeah. Go ahead, Jim. Tony, sorry.
I'm just wondering, sort of, what's the end point with this, Peter, as far as where you hope to be when you've healed up?
Well, hopefully, I might get away with just using a small adhesive pad to my jocks, which is how I started. And there's several chaps that I've spoken to who are members of the Moreton Bay Prostate Cancer Support Group, who are in they've had this procedure done several years ago, and that's about all they need to worry about. And half the time they don't do anything. They might just take one with them to be on the safe side. It's completely different once you start doing any heavy lifting or anything like that, which is unfortunate for me, being an old discus and shot putter. But yeah, hopefully I might just have to have one little pad in my back pocket and that's it. Just the stick-on ones for your jogs.
Matthew Denny's doing all right in that business. As an aside.
Glad to hear that that's sort of where you might end up with this, because that's a good result compared to where you are. The other comment I'd like to make is my good wife has just brought to my attention that around the Brisbane area, there's quite a lot of pads available on Facebook Marketplace if people want to go looking.
Yeah. Well, Larry Hamilton from the support group, he gave me the phone number of a lady who, I think she does the same thing. She goes around to various charities and so forth and buys up stock of pads, and then she hands them out freely to people who require them. Larry only sent that to me yesterday, so I've yet to make contact with this lady. But I'm pretty sure at this point in time I do have enough stock at home without having to go and get any more.
Is they're fairly bulky. They take up a fair bit of space.
You should talk to my wife. They're downstairs. I've got 2 packs lined up beside my wardrobe, along with toilet paper in case COVID strikes again. And yeah, the boxes aren't small.
No. Oh, well, the 8th of October is the big day.
The 5th.
5th. Yeah. Oh, the 5th, sorry.
Yeah.
5th.
Yeah.
Oh, we hope that goes well for you, Peter.
Yeah, thank you.
Any other questions or comments to Peter? Righto. Anyone else got anything to... Oh, George, you had a little procedure at the last meeting day. Would you like to tell us how that went?
Well, I'm not too sure what you call it, but it went all right. I had a couple of strictures. He said there were a couple of strictures in the urethra, and he showed them to me on the TV screen while I was on the table. And I said, yep, I can see all that. That looks like it's closing up a bit. We don't know why. It's probably getting old, I suppose. And so whatever they did, they opened them up a bit and things are flowing a bit freely again. And we had a tiny little bit of anaesthetic to kind of calm me down, I suppose, while it was done, and that was it. I'm back into it.
Now, what about inside your bladder?
Oh, no, he said that was okay.
Oh, good, yeah.
Yeah, so, well, he said, oh, look, I don't want to see you for 6 months. Come back, and he said, we'll talk about anything then, but he said everything. I asked him about the bladder, and he said, oh, no, the bladder's okay. But he didn't say that it's probably been a bit frozen by brachytherapy. I don't think it flexes and expands and contracts like it used to do years ago.
That might be to do with old age as well.
Yeah, that could be, yeah. Yeah, I usually sleep through the night all right. I don't get up now until 6 o'clock in the morning to go to the toilet.
Oh, good.
But I don't get to bed till about 11 o'clock, so I suppose that might mean that I'm kind of not in bed that long.
7 hours, yeah.
Yeah, but yeah,
So-
it went all right. Gordon O'Neill comes from St Vincent's in Sydney. He's the bloke I've kind of seen from the start of all the problems, and he's still flying up to Dubbo. But we've got another fellow in Dubbo now called Indrajit. He's permanent here. He resides here. He did a bit of training under a fellow by the name of Boulis. And I think he might have an associate now in Dubbo. So, yeah, we don't get many people at our prostate support group meetings, but I think younger blokes that get fixed up just want to get fixed and go back to work.
Yeah.
And, you know, just treat it as though they've been to the dentist and got the tooth drilled out and a new filling put in it, and then off they go.
Well, the important news is you got a good result on the day, so.
Yep. Yeah, it went okay.
Oh, good. Any questions to George?
No.
No. Who else would like to have a go? Yes, Bob.
From time to time, I get these little graphs that show the PSA readings, and of course, you always look at the latest ones, and it's going down in the right direction. But I've got two here, and they overlap a little bit. But I found something very puzzling to me. I started looking at the earlier bits. I was referred to the urologist when it went up here to 18 and then 15, and then it started to come down. But what I did was to put times and dates as to when all this was happening. And what I discovered was that when it was 18, I was referred to the urologist. 23rd of December 21, I had the MRI. It's down to 15. 23rd of February, I had the biopsy. It was down to 4. 29th of March, I had the PET scan. It was 2.5. Now, the ADT started on the 4th of April, 22. And the chemo started 16th of June, 22. So by that time, it was down to 1.8. Now, what's really got me puzzled as to why it was dropping so dramatically before anybody did anything. And I'm wondering now whether the figures are actually correct.
You went on any hormone therapy, any injections or pills before then?
From memory, now, of course, this is going back almost 2 years. The only thing that I can recall was the urologist prescribed, I think it was called Uridex or something, which was supposed to relax the muscles so you could pee easier.
Yep.
But as far as I can remember, absolutely nothing was prescribed or done, unless they did something when I was out to it at the biopsy. But even by then, it was down to 4. So that has me stumped. I really don't know what it's all about.
What they say your Gleason score was, Bob?
10. 5 plus 5.
Yeah, if it's 10, it's going to be 5 plus 5, yeah.
And yeah. So you can't really see there, but there it's 18, 15, and then it drops. But
we can see the graph where it comes up and goes along and then drops, yeah.
But the ADT started the 4th of April 22, which is down here. So
were you having problems with flow?
Not really, no.
because that might be an explanation that once you take the flow medicine, your PSA levels are going down because you're getting a better reading.
That could be an answer, because as far as I can recall, the only thing that I did in that period was I think it was called Uridex. I've thrown the books away because I stopped taking them 18 months back. But he prescribed those supposedly to make the urine flow better, but I really didn't have much of a problem at the time. It was slow starting, but once I got going, it was fine. So there's a problem. I mean, a mystery.
Yes, Peter?
Well, my issues all started back in March 2017 when I saw my GP, because I was doing what you were, Bob. I was having trouble starting. I had to sit. I was going, I don't know how many times a night. And he put me on Duodart. Now, I don't know what other names it goes by, but it did help my flow. So that was March 2018. My PSA readings for 2017 were less than 2. 2018, I think it was 2. And then 2019, it went up to 12.4. And that's when they started thinking there's something going on. And then it went to 17 and so forth. So it could have something to do with the improved flow, as Jim indicated.
Yeah, Peter, Duodart is duo because there's 2 different drugs in it.
That's right.
And one increases the flow. The other one is a mild sort of ADT.
Yeah. Mild, all right.
So you effectively are on hormone therapy when you're
I know. It was not a very pleasant drug to be taking, I can tell you that.
Welcome to our world.
Robert, what does your doctor say about the pattern of PSA results that you're showing us there?
I haven't got to ask him yet. I'll certainly ask him next time I see him, which will be in about 3 or 4 weeks. I mean, it's all history now. It's not really, it doesn't really matter. I'm more interested in what's happening down this end, like the latest one, which is going. But it really had me puzzled as to why it was dropping so quickly and so dramatically when nothing appeared to be happening. Nobody seemed to be doing anything. I was just going for tests. I'm sorry, I think my connection's dropping out a little bit. It seems to freeze up occasionally.
You're fine. You're fine.
Sorry?
No, we can hear you.
Yeah, I mean, it's, as I say, it's all history now. It's probably not important. I'm more interested in what's happening at these latest ones, which are quite good. That's now down to 0.25.
And what treatments do you want at the moment? What treatments do you want at the moment?
Only ADT and, well, that's it, only ADT.
Right.
I suspect, I don't know, but I suspect he doesn't want to put me on any of these abiraterone or the rest of them, whatever they are. While it is where it is now, he doesn't want to, if it ain't broke, don't fix it. It seems to be his attitude, and he doesn't want to put me on, I don't know, these pills, mainly because of side effects. And I said to him once, it seems to me that a lot of the medical professions are more worried about side effects than curing the bloody disease. And so I don't know, but he's quite happy just to virtually watch. And see what goes on. If it goes up, obviously you'll do something, but at the moment it's still going down. So therefore it's not doing anything.
Do you still have a prostate gland?
Yes.
You do. And have they done any scans at any stage?
I had the PET scan, back in March 22, and I had another CAT scan, about a couple of months ago.
Right.
And the images there were okay. I mean, they didn't show any new stuff.
So while it ain't broke, don't try and fix it. Your PSA is holding, and long may it remain steady. Any of the next steps are going to put more complications in your life.
But Rebecca came out by that. No, I asked him about Nubec, and he checked it out, and he said, no, you don't qualify because you have to start having that within 6 months of starting chemo, I think it was, or 6 months of starting the ADT, and I was beyond that, so I didn't qualify. But he did, as an aside, he said, well, don't worry, you're not missing out on anything. So, and at the moment, I'm quite happy to go along with what he suggests and what he's doing, which is just watching and watching.
Oh, well, you're not actually just watching, are you? Because you are taking ADT, so.
Oh yes, of course. Yes.
And your PSA is still dropping. How often do you have a PSA test?
Every month.
Every month, right.
Yeah.
So you'll know when it changes pretty quickly.
Yes.
Yeah. Yeah. I
mean, I just threw that in as a matter of interest. It's
well, it's different to what most people experience, what you've experienced. That's, I would have thought. So it is. But if you had a Gleason's 10, you wouldn't expect your PSA to be dropping it anywhere along the line without treatment.
What I was endeavouring to do was to track back and see if anything that I did was having an effect on the PSA, like in about June or July, I think it was, I started walking, and I'm doing 2 kilometres every day. And I've kept that up consistently. And what I was interested in doing is if I started that, if it had any effect on the levels, but it doesn't appear to show up of anything dramatic there, except it's still coming down. But that's when I discovered that early on, February, March, April, and May 22, it was dropping before the ADT even started.
Any other comments or questions?
Yeah. So PSA depends upon the size of the prostate. Perhaps the prostate has been reducing in size due to being able to flow well. That's all I can think of.
I'll certainly ask him next time, see what his opinion is.
Yeah, well, it'll be interesting to hear the results of that. So it will, yeah. Anyone else got anything?
George has got his hand up.
Has he?
Look, I would suggest with that problem that it may be worthwhile to put together a very complex graph that you can roll out in front of the doctor when you see him with all the information on it, and he can see straight away what's happening. I started a graph years ago in about 1982 with every PSA reading on it. And I can just, the graph's now about 4 or 5 pages long, and it all sticks together and rolls out like a scroll that you see on the medieval days of the nights on the TV, and I can roll it out and you can see what's happening. And I always tell the pathology people to post me a letter, post me out the results, so that if I've got questions for the doctor or the urologist when I get to see them, I've got the graph in front of me, or I've got everything kind of recorded and straight in my mind what I want to ask. But on your graph, above where the column stops, you can write little notes, and you can write the dates, and you can write what treatment you've been on for that period, so that it's all written down on an A4 size graph paper, glued together, sheet by sheet. That's all I can suggest.
No, I'll certainly do that. I'll certainly do that. And what I've done now is I've timed the PSA test to be about 2 or 3 days before I get the ADT injection. So I have to see the doctor before I get the injection. So I ask him then what the reading was, so I know straight away then each month. Well,
I usually don't worry about asking the doctor what the PSA reading is. I get that straight from the pathology people, and in a lot of cases I know what it is when I go to see him for I'm on a Zoladex, which is ADT. I have that every 3 months, and I have a blood test every 6 months now. That's all I have. And if the graph looks a bit wobbly, then I can ask him the appropriate questions of what's happening.
Mm-hmm. Thanks, George.
But it gives you a complete history of what's been happening to you, because you forget over time and you can't think, and doctors don't want to spend a lot of time with you these days now. They're pretty busy. So I like to have the information on hand.
Well, I'll certainly do that.
Thanks, George. Yeah, I try to have my blood test. If I'm having blood tests, I try to have it just before I have a Eligard injection rather than just after I've had it. Okay, that's just how I am. I don't know whether that's necessary or not, but because
that's what I do with the PSA test. You have it 4 or 5 days before you go in for your Zoladex injection, and you can ask him while you're laying on the table getting the Zoladex placed in you. You can ask him about the result.
Do you have yours every 84 days?
Yep, right on the 84 days.
Yep. Do you have yours every 84 days, Bob?
No, every 28 days.
You have it monthly injection. Yeah, some of them don't want it. They want to give it to you in 30 days or something like that rather than 28.
Because it says somewhere I'll have it every month or every 3 months. Well, as Jim pointed out, and at one stage I had a bit of Cosudex tablets in the box with the Zoladex, and there were only 84 tablets in the box. And I thought, well, that's not 3 lots of 31 days. It's only really 84 days. And Jim brought that up at one of the meetings, and I thought, yeah, that's dead right. It's an 84-day thing.
Right, yeah. If there's no further business, we might say goodbye and thank you all for your attendance and appreciate your time.
Okay.
And we'll see you in the daylight saving time.
Yeah.
Thank you.
Thank you.
Right.
Bye.
Bye-bye.